started, I do have a little bit of a disclaimer to make. I am not Beth Hunt. My name is Audrey Arwood, and I am a clinical resource nurse with Community Hospice. I've been with Community for over 15 years. There is some movement going on about a pulse document that would transpire between states. I don't know what the state of that is, but there is a movement going on. I actually have a good friend who actually works for us here at Community that has actually been before the state's Congress to talk about these things. But right now, the law is that yellow DNR form needs to be filled out. So if someone is coming from a different state and they have a DNR in that state and they need to get a yellow one done. Because that's the only one that Florida recognizes. And he'll move forward too. So it is a physician's order. On that yellow form, you'll know that the physician has to sign that. So that's why I say that you guys wouldn't be able to fill those forms out specifically. But if you have someone who says, oh, I want a DNR, then you need to contact the volunteer coordinator so that they can get with the nurse and the nurse get with the doctor and therefore get it done as soon as possible. Yes.
Is a DNR part of the admission process for hospice?
It is, and it's a required part of the admission process from CMS's standpoint. They have to at least have that discussion. Now, a patient can say, I want to be a full code. That does not mean that they can't come on the hospice. It doesn't mean that we want to admit that it's hospice. Okay?
They just have to give you what they want. I do want it or I don't want it, so you talk to them.
Yeah, well, we have to have the discussion, and they can say, I don't want to talk about that right now. That's okay too. Because sometimes when patients come to hospice, they're not ready yet. They just learned that, hey, I have a terminal illness. It can be very overwhelming for some patients and some families. And they need to have discussions with people. You know, it's very important to have those discussions. So we never force a DNR on anybody. I mean, I've had patients who were full codes right up until the very, very end. And then, you know, they finally said, yes, I will sign it. You know, so it is a very personal choice for a lot of things. Sometimes there's religious and spiritual aspects of a DNR for someone's choice to become a DNR. And we have to recognize that and respect that. Yes.
Can the healthcare surrogate sign it for the patient?
Yes. Yeah. The healthcare surrogate can sign a DNR if the patient is not able to make their wishes known. That's why it's so important to have those discussions ahead of time. Because you want your healthcare surrogate to be the person who's going to speak what you want. Not necessarily what they think is right, because they may not know. And how are they going to know what you want unless you tell them?
Is the surrogate sometimes the only person because there's nobody in the family that's left?
Sometimes, yes. Yes.
As a volunteer or volunteer in the hospital, do I have the right to choose not to go to somebody's home or in the nursing home?
Yes.
If you don't believe that about having a CPR done. In other words, if a patient wants to be revived, do I have the right not to be a part of that visitation? In other words,
Yes.
I was just going to say, I do believe that you would have the right to not as a volunteer. You are a volunteer.
so
So
I could ask the
No.
nurse what is on her record.
do they know when they get an assignment if they are a
That's
DNR?
not something that's not normally asked. It's not usually
No.
a point whether they're gonna take an assignment. So if that's important to you, you would want to ask the volunteer coordinator prior to taking an
That's what they
assignment.
did.
Yeah, like,
But I haven't
yeah.
talked about.
Yeah, so make sure you have that discussion. Yes,
So ma'am, I had a neighbor who was looking after him, not legally, just helping him out. Yet no one, no family in Jacksonville. And then I took him to the hospital, an emergency.
Mhm.
He was close to finish line. Do I become a surrogate automatically or what?
no, not automatically. There's a progression of who is designated as the surrogate. And it usually starts off with family first and then goes down the line.
Mhm. And with the way you're talking, I should be having one DNR too, right? I'm healthy, I'm fine, but I should have a form signed, right? I mean,
Not yet.
So I do have some advice on who should be a DNR, and we will talk about that.
okay.
Okay,
Mhm.
Judy.
What about people that come, emergency services and they come from, and the person has a yellow form on the refrigerator or something like that? Do they look for something like that? Not that they would go to the house.
You know, I couldn't speak for emergency personnel because I've never been a paramedic or an EMT. I know that if I call, they're gonna ask me, is that person a DNR? Because I'm a hospice nurse.
But if no one's there, if it's just the person, and they have called for help, and now somebody has come. Maybe they have a call for help. What
I don't, they're going to do everything. They're going to do everything
they're not. Gonna- I think there's something on the refrigerator.
I don't know if that's where somewhere they would look or not. I always tell families put it above the bed. But, you know, tack it up on the wall above the bed. But that's not to say that a person wouldn't be found in the bathroom down, you know, and so I don't know. They're probably gonna do everything they can. And so it's up to the people around to point out the DNR.
I know in our beginning, we were asked to put something in our refrigerator.
Yeah.
And so I'm assuming that when people come into our community, we look at it because they know that that's something that they do in that. So that's why I'm asking, is that no?
And they may know that. Like I said, I can't speak for emergency personnel and what their policies are.
Where should that yellow document be kept?
So that's just kind of related to what she said. A lot of times people do tell them to put them on the refrigerator. And I have also told patients to put it above the hospital.
Not in your wallet.
Oh, there is a little part that's just
Oh,
that. I don't know if they gave you the full form.
Yeah.
There's a little piece that you can be cut out and you can put that in your wallet. You see down here at the bottom. You can cut that off.
Hold up at the top.
Oh, okay.
The yellow.
All right, so, all right, let's move on. All right. So we already kind of went over this first point. A DNR is not required to be admitted to community hospice or to remain in the hospice program. If a patient does not have a DNR, I'm going to say DNR because that's what I'm going to do, and has a respiratory or cardiac arrest, CPR is initiated and 911 is called. So, as a hospice nurse, even if I have a patient who's starting to decline, and they do not have a DNR or they do not, the family does not want them to be a DNR, I'm going to, suggest that they either call 911 or I'm going to call 911. I've actually had to call 911 for patients who was a DNR because perhaps maybe they fell and hit their head. And sometimes we still have to do those things. Again, DNR does not mean we do not treat. So when we have injuries and things like that, we still going to treat. Right. What are the hospice rights regarding a DNR? The hospice patient or their surrogate has the right to refuse care or treatment. So they have a right to have the care refused. And that's basically what a DNR says. It is them exercising their right to say, I do not want DPR support if I have an event. A hospice patient or their surrogate can also exercise their right to revoke the DNR. So at any point that a patient has a DNR and they say, I don't want to be a DNR anymore, I want to have everything done, they can do that too. So, and that has happened. I have had patients who have revoked their DNR. And so basically what we do is we make sure that we have an order to have that revoked in the system, make sure it's known by everybody, and then we take the DNR and all off of it in the same way. If the patient at some point wants to become a DNR again, we have to get that full form filled out again. It's not really a big deal. We have a system now that they can do it electronically. They can sign it and we send it to the doctor, they sign it, send it back, and then it's in the system, and we print it off on yellow paper. And put it up on the refrigerator or above their bed, wherever the patient wants to have it. Yes.
What happens if the patient wants it and the family doesn't?
If the patient is able to make their own decisions, if they're alert oriented to themselves, which means they're able to tell me who they are and where they're at and what day it is, then they get to make that decision.
We'll say they're not,
If they're not, then it is up to the healthcare surrogate.
which would be the doctor.
No, that would be the family member or whoever the power of attorney, whoever the patient has deemed it to be their healthcare surrogate in the event that they cannot make decisions for themselves. But it takes a lot for a patient not to be able to make that decision. It takes a lot. They have to be really being not able to. And there are times that sometimes patients go in and out of that state. My mother, there have been times that I've had to step in and make decisions for her because she wasn't able to. But then now they say she's good. She can make her own decisions, which sometimes is a bad thing, but. But, so she kind of comes in and out of that. So sometimes we just go in and out of those states. And we have to evaluate each time, every time. It can get kind of hairy.
If a patient has that in place in order to do not, can a family member override it?
Yes. If they are not able to make their decisions,
Even though they have been in place.
even though they have it in place.
Huh.
Okay. Yep. And that happens sometimes.
That stinks.
Yeah, it does stink. It does stink, but it is the rules. It is the law that if a patient has a DNR and they signed it when they were completely able to make their own decisions, and it is there. We do encourage families to honor their patient's wishes. But that's all we can do. If that family member says, no, I want you to perform CPR, we have to perform CPR.
You 100% sure that's the law?
Yes.
But if you've designated like one of your children should be your surrogate and another kid decides he wants to revoke it, you can't, right? It's a surrogate.
And the surrogate would have that.
So be careful.
But
It's pretty-
it is not. That surrogate has let this other person in charge of mine. They go on vacation, then they're going to follow that next person. Make sense?
But what happens if the surrogate is, I have a daughter in Tallahassee, let's say I've signed it, I don't want to be excessive. What happens then? She's on the way. Well, we would get together.
Yeah, if this was here and your surrogate wasn't around, but this is here, this stands for, the DNR would stand for what you want. And that, they would honor that. It's only when somebody else comes in and says, no, once you perform CPR.
But if you're the durable power of attorney, you can do all of that, can't you?
Yeah, that's the same. Yeah. Good questions, guys.
Yeah.
All right. So our admitting staff, we already kind of really talked about this, really inquires wishes of the patient about DNR measures. Inquires if there's already a DNR in place. So do they already have one? If it's properly executed and is available, we always get a copy for our records. And we document that in the patient's chart in our EMR system, which is our electronic medical record. Okay, and their wishes. So it is a CMS mandate that is part of our admission process. Do you have a DNR? What are your wishes regarding resuscitation? If you want to move forward. If a properly executed DNR is not available, then we request one if they want one. Once it is signed by both the patient and the physician, then we can put that in the chart. Now, it does say properly executed Florida DNR, which means things are signed properly. We always look at all of that, making sure that it is correct, because we don't want, a patient to be resuscitated who doesn't want to be resuscitated. Right? So we have to make sure that all of that's correct. And one of those things, and you think it's probably really silly, is that it's on that yellow paper. They will not honor that if it's not on that yellow paper. Don't know why, they just won't do it. So we want to make sure that it's on that yellow paper. Okay. It is always the patient or surrogate's right to decide. We kind of really have had that discussion. And we really do support whatever their wishes are, whether it's to resuscitate or not. I remember the story that one of our other clinical resource nurses tells, and she had a patient. He was in a long-term care facility, and he did not have an DNR. He was full code. And this guy was obviously at the end of life. But the facility, the long-term care facility, really was kind of after her to get the DNR sign. Every time she went in, it was like, hey, you really need to get that DNR sign from here. You really need to get that DNR sign. He was alert and oriented. This guy was a medic in the Army. He knew what CPR looked like. He understood it, but he still wanted to be a full code. And so we as clinicians have to be very mindful that we're not pushing that agenda on somebody. That it is a patient's right and to choose as for as long as they can. Now, eventually what happened was he did go into the hospital and become unresponsive, and then his family had to make that decision to make him be in. But that's what he wanted, and she said, I had to realize that I could not push that agenda on him. That even though the facility was hounding me to get that DNR signed, that it wasn't I couldn't force that on him. It wasn't about my goal, it's about his goal and what he wanted. So no, our DNR is not honored in other states. So if you take a Florida DNR to a Georgia, they're not going to honor it there. So you need to make sure that if you do have a DNR, you want to be an NR, you need to make sure that you understand what Georgia's requirements are, North Carolina, wherever you're going. And a DNR from another state will not be honored in Florida. So, if you want to pull out your nice yellow DNR form, we'll kind of just go over. A what? Oh, you're going to hand out. They get you some. Does everybody have one? So at the top of your form is the patient's name and date of birth. And then you'll notice that it is signed by, it says, patient or an authorized person, not as your healthcare surrogate, whoever that is, our attorney, whoever it is that's been designated. And then they print their names and it asks them, how are you the designated person? And then there's all the the ways that you could become the designated person. And then the healthcare provider needs to sign. So the doctor needs to sign and put the license number on there. Or print and then their license number, then sign and date it, and then give a phone number to call. So all of those things must be filled out, and then you can see it is repeated kind of down here.
Does the wallet card have to be signed by the physician? Is there, it's not.
No, it's,
This thing.
yeah. But yeah, it does have to be signed down here. Signature. So it does have to be signed. I don't know why they didn't sign it down there, but yes, it does need to be signed in both places. Otherwise, they may not honor it. It kind of just goes through completely everything that you talked about.
Does not have to witness the patient signature.
No. No, they just have to sign it, yeah.
And then they can take it over there and get signed by the doctors.
Usually the doctor's gonna want, it's the patient's doctor, but they're not gonna sign it for just
Right.
anybody.
Right.
They have to know the patient, before they'll sign it. The form does not expire, and even past versions, so they update them regularly, but even past versions will be honored. So if they update it, you don't have to have them re-sign one. It can be revoked by the patient or their legal representative. And it can be revoked just by saying, hey, I don't want this. I want to be resuscitated. It can be done in writing. They can cross through it, whatever they want to do. Physical destruction or failure to present the form. And they can just say, I don't have one. And if they don't, it can be revoked. So there are some special circumstances. If a patient experiences a cardiopulmonary arrest and does not have a DNR, and the surrogate is present and expresses that he or she, this is in our inpatient units, does not wish to have CPR initiated or 911 called, the surrogate's expressed wishes are respected, and the surrogate will then sign the Florida DNR. So the physician will be contacted, and they inform the surrogates of the surrogate's wishes, and the DNR will be signed by the surrogate. Both the wishes of the surrogate and the conversation with the physician are heavily documented in the clinical record. That's really mainly for our nurses so that they understand that if they're in the middle of a code and the patient is a full code and the surrogate says, no, I don't want this done, then they can go ahead and get that order and they can stop everything. Yes.
Do you know if copies of them do not participate or
About it.
copies?
Copies of it, yes.
But you can have the original, you can have several copies like the.
Yes. Yeah, yeah, as long as it's on the yellow paper.
Yellow paper, copy is.
So if they're in the middle of it and they don't want it, and it hasn't been signed yet, what do they do medically? Do they continue working or they stop it? Even though they haven't been signed?
Yeah, but they're gonna whip out that paper pretty quick.
Yeah.
Let's see, patients that are transferred from a hospital that have signed the healthcare facility specific DNR. Because sometimes there are different facilities that have their own DNR. And then they arrive to the IPU. They will honor to that for 24 hours until a Florida DNR can be obtained. So sometimes when you're in a hospital, I know you probably have been admitted, some, or gone to have a procedure done or whatever, and they ask you about a DNR or advanced directives. Sometimes they have their own forms that they will do in-house. Those are only valid for in their house, but a lot of times our units are attached to those hospitals. And so they'll honor those for a little while until we can get one of these filled out. Okay. Is basically all that says, and it can be revoked again at any time. In our home care setting, if a patient experiences the cardiopulmonary arrest, and they do not have an DNR sign, and the surrogate is present and expresses that he or she doesn't want CPR, it basically follows, the same as the inpatient unit. We will respect those wishes. But we get them to sign that DNR, like I said, pretty quick. All of my nurses carry things with them. They're on their computers actually now, and they can have them done. The physician is contacted, so that they can get this signed pretty quickly. And then we make sure that it is documented to us. Yeah. So that, we're not getting any problems, so. Remember that we do not have to have a DNR for admission, so you may see patients who do not have a DNR. It is a legal document, and they have the right to refuse resuscitation at any time, and they have a right to say, I do want it at any, regardless of this being. Okay.
That it?
That may be the end of that's it. Yeah. I do want to talk about, we kind of really talked about the compressions when it comes to CPR, but there are other things that can go into it. Breathing into the mouth to get air into the lungs, electrical shocks to the chest. I know you've all seen them bring out the paddles. They don't really do paddles so much anymore, but they do still shock people.
And how can you talk to somebody who says, I don't want to have the chest compressions, I don't want to do that. But if I'm having a heart attack and they want to use a defibrillator or whatever, then that's okay. But how can you delineate which and what?
Then
Are you?
they
For those of us who are
do
not nurses.
a living will, right? So they could say, I want this and not that. And even when I did my little stint at Orange Park, they have specifics about that, but this will not designate the difference, the differentiate. My thing is to just let people know that that's what you want. The electrical shock is like a donkey dose thinking you have the chest.
Okay.
And I've seen someone die who had an implanted cardiac defibrillator. That's not pretty either.
That was my question, is how the living will and the DNR can overlap a little bit, right? Or
It can.
the living will can lead you to think that they probably want a DNR. I mean,
Yeah. It can help have that kind of discussion. Yes.
so it's important that you have a living will.
It's important to have a living will. I will say that.
Which one is more primary? Which one will be honored first, the living will or the DNR? If there's a conflict.
I think if there was a conflict, the one that was on the left takes precedence. If there's a conflict, if the living will said, I want everything done, and then the patient signed the DNR after that, if that lapse would take precedence. In my living will, I have made a living will, states that you are to do everything and you are to keep me on a ventilator for 6 weeks. That's it. After that, you go club. And it also says that if I am close to death, you better give me ice cream all the time. Don't make me eat anything gross. I don't want any broccoli. I don't want any bran muffins.
And that's it, what?
If I'm gonna have a terminal diagnosis.
So that's for the last how long?
If I have a terminal diagnosis, just let me eat ice cream. That's all I want. Just whatever I want.
For 6 months?
Yeah, for how long? I don't care if it's 10 years. Butter pecan. Pacific.
That seriously is in here?
Yes, I kid you not. I have it written out. Yep, it's on my computer. Oh, my husband. Yeah. So. And I
And give me a glass of wine every night. Hopefully not that way.
It is also administering certain medications to the heart.
What's that?
So what's that like? So, if someone is if someone's getting a code performed on them, they will administer certain medications to help the heart, things like epinephrine, up, atropine, they're all, basically to restart that heart. They want it to restart. Sometimes they'll do things to stop it, to try to get it to restart in a correct rhythm. It all depends on what rhythm that heart is in. Just a little note, they won't shock asystole, which is that flat line. You know how you always see, they always show the flat line
Yeah.
on TV and then they shock them? They won't shock asystole. We don't shock asystole, you're not gonna do
What was that? No shock what?
asystole, which is with a flat line.
Oh.
Which just means no heart rhythm. I just find it funny sometimes on TV when they go and they start shocking them. I'm like, asystole, there's no need to.
Can I go back just for a second? So for your situation with what you're looking at, both sides, you don't need a DNR ever. Is that correct? Would that be?
Well, you know, I might change my mind
I see, right.
if I had a terminal diagnosis, but this is if I were to just have some event and I get put on a ventilator. I do want CPR because there are instances of where people, you know, who have no terminal diagnosis. I've worked in ICU, so I've seen, you know, patients who they thought would not come back. And so I've seen the result of what some rest, they let your heart rest, they let your brain rest, whatever. Because I've done neuro and I've done cardiac ICUs, that, you know, people do come back from these events. But, you know, if you're going to be in a vegetable kind of state, then I want them to, you know, discontinue that. But if you have some sort of, and we're going to go over who should have one. It could also mean inserting a tube down the throat to help someone breathe. And that's usually the part that people don't want. They don't want that tube to help them breathe.
That's interesting. Of all the things, I wouldn't have thought that would have been scary. And
If they've ever had it done before. Some CPR facts, and you have some of these facts on that front page there. Hospitalized patients receiving CPR have approximately a 25% chance of survival to live to discharge. The patients who are in the hospital and they receive CPR, usually they're in the hospital because something has brought them there. And then they have some sort of event. They only really have a 25%. So those who received out of the hospital CPR and then were hospitalized only have about a 12. Live into discharge. And then as we age, that survival rate goes down. People who are between 65 and 79 have an 8% chance of survival. People who are between the ages of 80 and 89 have about a 4%. And then if ages greater than 90 have about a 2% chance. So I promised you I would go over who should have a DNR. So those that we have on here that say that you should have a DNR is someone who is near the end of life, or has a terminal illness, or has a serious illness that will not improve. So all of those patients. So someone who has who is near the end of life, has a terminal illness or a serious illness that will not improve.
but anybody could.
Anybody could have a DNR, yes. But those are the ones that they suggest here. Here's a question that we saw earlier. Is a living will the same as having a DNR? No. A live-in will instructs the healthcare surrogates and healthcare providers on what care and treatments the patient wants when they are unable to make decisions for themselves. So when I'm unable to make decisions for myself, I want ice cream. A DNR is a medical order that is signed by the patient's doctor that is immediately implemented to prevent CPR from being started in the event the patient's breathing and or heart stops. Okay. So DNR fast facts.
Got about 3 minutes.
Okay, all right, we're finishing up. DNR is a form. It is only accepted in Florida. And it says form 1896, so that must be the form number. You know, they always give numbers on government documents. DNR forms from other states are not accepted in Florida. And we've already kind of really talked about how the DNR can be revoked at any time. And for it to be legal, we talked about how it's to be printed on that yellow paper. It has to be signed by the patient's healthcare representative or surrogate, signed by a Florida licensed physician, and kept in a place, here we go, it does talk about this, above the bed or on the refrigerator. So,
Is that on this paper?
I don't know if it's on that one or not. They're not on there, not all of them.
Everywhere.
So any,
Oh, it is here. What did the DNR look like? It's right here. It says it should be kept in a noticeably accessible place and above the bed or on the bed.
Yeah.
As many first responders are instructed to look for information on medications in these places.
there we go. So they do know to look at the refrigerator. I'm sure they're gonna do whatever they need to do first and then, oh, okay, I need to look for A, B, and C.
Yeah.
Because that's what they're trained to do. And even as nurses, we are trained to save a life when we come in. Part of my mission in life is to find a way to bridge the gap of the education system of nurses and hospice care. And nurses were taught how to save a life, and sometimes to no end. We also need to be taught on how to have let a patient die naturally. You know, so that's part of my mission. So,
We have time, any more time?
yeah, I mean, I think we have 15 minutes before the next class, but and that you guys are good to go unless you have any other questions. I think you did good with the amount of questions that you have.
Yeah, the next class will start at 11, so you have about 15 minutes. Then we can go back. Yes.
We don't know anything.
Right.
So for me personally, really, I don't manage to pay help because I'm an accident, I'm all big, I'm all of a sudden, and after it happens, I can.
Right.
But it's going to be, over, what is the word? Questions, yeah. It's just like this is your, I don't know that you have it, because we can't do it when we probably should do it. Yeah.
So you are not married that time?
I am not married at the time. I am Audrey Arwood, H-E-R-E-Y, Audrey Hepburn. Arwood is A-R-R-O-W-O-O-D.
Looks like Arrowwood, but it's R.
Is friends. Yeah, that's what I have there.
Thank you. That was. I have a special. Sure thing. See, I had more.
We're the positive.
Well, what is the balance?
It's a big house. I was right.